Hey there, and welcome to the Hit Like a Girl podcast. I'm Joy Rios, and today I'm talking with Anna Lindo, the CEO and co-founder at Brave Health. Anna shares the company's unique approach to virtual behavioral health and how she stumbled upon tackling one of the most convoluted areas of healthcare, Medicaid. She's working to support some of America's most vulnerable populations, and in our conversation, I learned that at least 1 in every 5 Americans suffers from a mental illness, yet more than half don't get treatment or medication. She's working to change that. Let's take a listen. So, Anna, I am so grateful for this opportunity to spend time with you today. Thank you for joining us on the Hit Like a Girl podcast.
It is my pleasure to be here. Thanks for having me.
Thank you. I like to think about healthcare and health IT as this like 3,000 or 10,000 piece puzzle, and we all kind of hold a piece of it. We're essentially trying to share with our audience, like, what is the full picture? Would you mind taking a minute to introduce yourself and talk about the piece of the healthcare IT puzzle that you hold on to?
Absolutely. Yes. I think 10,000 piece puzzle is a good way of saying it. So I am the CEO and co-founder of Brave Health. We are a virtual behavioral health provider and engagement platform. And the way I would think about the puzzle piece that we hold is probably to describe us as like the engine that powers behavioral health outcomes, particularly for Medicaid beneficiaries.
Oh, okay. Is it in all 50 states?
Not yet. We're in 10 and counting.
Okay.
So yeah.
I would imagine working with Medicaid is a challenge. Can you talk about like some of, maybe just the process or the journey of how you've gotten to where you are now?
Sure. Well, a lot of paperwork, a lot of notarized documents. You get really familiar with the notary process, working with government programs. In some ways it's challenging. In other ways, I think I think there are advantages. I think there are things that are really clear and transparent in working with Medicaid that are not as clear and transparent. So there may be processes could be long, or maybe they have a lot of steps, or maybe they can take time between steps, but the processes and even the reimbursement amounts, the goals that the states are being held to, the expectations that plans have for providers are all really clear. And that's something I love and have loved about working with Medicaid plans since when we started. And it's really been something we've had conviction around from when we started Brave, is that unlike other parts of the healthcare universe and the puzzle that can be both complicated and opaque, I would say, of course, working in Medicaid has complexity, but it's not really opaque. And I think that's a really cool thing, especially for people who are healthcare entrepreneurs. We get to look at the information and do our diligence and get access to things like fee schedules. And you could never get that from a commercial plan, so it's something that has helped me from the beginning in just knowing how we wanted to approach the problems that we're working on, where we wanted to start, which regions we might be able to have the most success in. Those were things we could look at and make informed decisions on, which is a real benefit, I think, in any sort of entrepreneurial pursuit. When you're attempting to do something that maybe hasn't been done before, lack of information is one of your enemies, right? The less So the less that you know about the field that you're going into, the less you can deduce, the harder it is to get a sense of the possible outcomes or the possible pitfalls or the possible opportunities. And I think it's something I didn't totally realize about Medicaid until I had worked with multiple different facets of the health insurance universe, that there is so much more transparency than you might get in other areas.
Yeah, so I don't follow the state rules as closely, but I have definitely kept my finger on the pulse of the federal rules for about the last decade or so. And one thing that I like about it is, to your point, they give you an idea of what their vision is and what their goals are and how the steps that they're going to take and how to get. That was actually part of the reason why I chose to get into health IT from the get-go because they had outlined their strategic goals. This is what our plan is for the next 5 years, and
Because
this
you
is,
do work in the EHR world, right?
yeah, I'm a subject matter expert in the quality payment program and specifically
Yes,
on the merit-based incentive payment side. And
incredible.
so that is something that, like, there's a lot of they took 3 government programs and then melded them together and then, like, kind of helping decide, okay, what's our path forward. And they give you so much information around, like, okay, what are our thoughts about it? What's the feedback that we've gotten and what's our commentary around the feedback? And then, coming up with a plan from there. So if you're paying attention, it can give you some real business insight.
Absolutely. Absolutely. Yeah. And I think um, there are similarities at the state level. And one of the sometimes challenging elements, but also, again, opportunities is that there is variability state by state. So there are similar elements in terms of knowing where the lawmakers and regulators are headed and how that's going to impact the delivery of care and reimbursement for it on the state level and the Medicaid universe as well. And it's interesting because not every state acts in the same way on the same timeline. And so you might have situations where something becomes permissible in a state and there's a lot of opportunity to try something and not every state's adopted, and that's okay. And it gives us the ability as people who are trying to innovate in this space to look for those opportunities and do cool things in the states where certain things are being experimented with. And so I love that. I love the variability and the possibility that that affords us.
So can you tell me more about Brave Health in particular? What are the products and services that you all provide?
Absolutely. So as a behavioral health provider, we're offering the services that help people improve their mental and behavioral health and, really with an eye towards their health overall. So we have, your services like therapy and psychiatry. We do a lot of work with individuals, engaging them in care to begin with, and then keeping them engaged in care. But we're looking specifically across a few different sort of specific axes that tie in a really important way, I believe, into a lot of the broader healthcare discussions that are going on. So this coming back to the concept of healthcare as a puzzle, we strongly believe that behavioral health is always a piece of a puzzle, right? Your behavioral health is part of your overall health. And when we think about behavioral health as fitting into the public health picture, it can inform some of the decisions we make and what we prioritize. So for us, we started when we first launched, really focused on medication assisted treatment for opioid use disorder, which I'm really passionate about and which is really important. But very quickly, we expanded to treat other behavioral health conditions, really because we saw OUD as part of a bigger picture. And health plans and our patients were saying, hey, can you work with us on some of the other conditions that we're seeing? One of the first ones that came up that we spent a lot of time and focus on, and that we still really focus on in some of our markets, is serious mental illness. Folks who have moderate to higher, when folks getting to that higher acuity side of things, we do work with a lot of folks with moderate acuity as well. But serious mental illness has been a place where we've been able to develop some programs that really work for those audiences and work really, really closely with some of the health plans that have specialized teams and even specialized benefits for SMI. And that's been a really cool experience, just because I think it's an area that doesn't get a ton of attention and doesn't get a ton of focus historically, or historically hasn't maybe gotten as much focus that is really needed. So that's been really fantastic. And then there's a couple other areas that we've started to develop around, again, things that affect communities, right? When we say we're a community mental health provider, our job is to work on the things that are going to be really impactful for the communities that we're in. So those include, but are not limited to, maternal mental health, working with adolescents, and now in 2022, starting to work with kids even a little bit younger than adolescents, and then also working really closely with primary care and with hospitals and folks who are transitioning from a higher level of care. And you'll hear there's kind of a theme throughout these. One, that theme of what do communities need? What do we think is going to have a really big impact? And two, what do we think we can do to support the bigger puzzle, not just to operate on our own, but also to fit into what other providers are doing, whether that's a hospital in a community, whether that's a primary care provider or a pediatrician, whether that's an OBGYN, whether that's a health plan case manager. The things that we work on and the areas that we focus on tend to be areas that touch one of those categories I just listed. And that lets us get different and better results, I think, than if we were to try to operate outside of the system altogether.
I'm really curious to hear about how you're supporting moms and adolescents. Can we talk about those two in particular?
Sure, absolutely. I mean, I can't emphasize enough how important I think both populations are for us to be thinking about as a community health organization. In terms of moms, I think it's both working with health plans who tend, our experience has been the health plans that we work with do a fantastic job of connecting the women that they're working with to resources and making sure that the pregnant people that they support have the opportunity to connect to resources, not just after pregnancy, but during pregnancy, both of which are important in terms of supporting mental health. And then for adolescents, I think, we're at very sadly, I think we're at the beginning of a really big effort we need to make as a society. This is not something that is going to change overnight. It's not something that's going to become fixed, right? It's going to require a lot of different contributions from different places, both on the ground and virtually. Obviously, we deliver care virtually, but I think there's certainly a capacity issue. So one of the first things we're trying to do is simply create access. But then there's also, the need to make sure that we're offering a variety of services that are needed. So one piece, like I said, that we like to think about and focus on is figuring out ways to support and work with pediatricians, but then also to work with families. So one of the services we offer is family therapy. I think it's important to think about, okay, what are we doing not just for the individual, but also for the caregivers in their lives?
I love that. I mean, I think that's, always been important, but especially now in the age that we're in pandemic land, I can imagine that your services are well utilized and hopefully like more people are taking advantage of your offering. Has there been much of a change as, over the last couple years, through COVID? And can you speak to that?
Yeah, absolutely. So, Brave was actually a fully virtual organization before COVID, which was kind of interesting. We had this really fortunate situation in which we didn't have to change our care delivery model, which was good because it meant that we could just really focus on meeting the need, which was immense and continues to be immense. So our model didn't change, but what changed was the world around us, right? In many, many, many ways, many too many to count, but specifically as it relates to virtual care, I think two things changed. One was health plans began reimbursing for services and talking about services and supporting the use of services via telehealth, even some that hadn't before. And then the other thing that changed was patient behaviors. So whether that was a question of somebody who might not have been interested in telehealth before, or maybe was open to it, but just hadn't had an occasion to try it. Those shifting behaviors, both on the side of plans and on the side of patients, led to obviously a shift in adoption. And for us, that meant like 20x growth in a year. But it wasn't necessarily, what was interesting is at first I thought we would see a lot of sort of situational stuff, like people coming to us as a response to what was going on in their lives because of the pandemic. But it wasn't as much that, and it really hasn't been as much that. It's been more people seeking care that now feels available to them that may not have before. Maybe it was available to them before and they didn't have awareness or perhaps inclination, or maybe it wasn't. Like there are health plans that did not reimburse for telebehavioral health services before the pandemic and now do. So it's been an absolute paradigm shift that I think is never going to go back to whatever quote unquote normal was before. But I like to say necessity is the mother of adoption. Like it's not so much that something new was invented, it's that the way that we use something that already existed.
For sure. I mean, I have a therapist, very happy with my relationship that I've had with her. And because of the pandemic, we transitioned from meeting in person to meeting online. And that has been a game changer / lifesaver to have somebody who's available kind of, I have an appointment. I don't have to rearrange my day to like be there in person or sit through traffic or that sort of, any of that. And I'm hopeful that I think we probably could go back to in person, but I don't think either one of us have any intention of doing that because it's so effective. And I was curious when you said about family therapy, is that also something that happens virtually now?
It can be. And I think one of the things that's cool is when we think about delivering services to people who may not live in the same house or even city or even region of a state or even state. We operate in multiple states now. There are ways that we can use telehealth to our advantage to do things that wouldn't have been possible before. So for instance, I'm thinking about a particular therapist on our team who's a marriage and family therapist who was working with a couple who has a blended family. And for a period of time, the couple, were living in the same home. And then at some point, they started living in separate homes. And she was able to continue working with them, even though they were living in completely different parts of the state, and work on the issues that they were experiencing in their marriage and in their relationship and things they wanted to work on. So in service of the possibility of living again in the same place in the future. And those are the kinds of things where, there always are going to be elements of care delivery that we want to have happen face-to-face in an office. And I am the first one to say that telehealth is not the perfect thing for every single type of care delivery. But I think what even I didn't fully realize until we started to do, work in a lot more use cases than we had seen before. Even I didn't fully realize that there are times when virtual care affords things that wouldn't have been possible otherwise. And I think that's exciting, especially as we think about the benefits of continuity and the fact that, you could have maybe a youth in the foster system who lives in different places throughout a state and having consistent relationships with their care providers is really helpful. So there are things that telehealth allows us that, they may seem subtle, but they can actually have a huge impact and they wouldn't have been possible otherwise.
Oh, I'm so glad to hear that, that's where you get to spend your time and make an impact because it's very needed.
Thank you so much. Yes, we're really fortunate to get to take on some really cool problems.
So can I ask about you personally?
Absolutely.
Did 10-year-old Anna know that she was going to be the CEO of a behavioral health company? Did you have any clue what you wanted to do when you grew up?
I really don't remember having any clue that what I wanted to do when I grew up. Maybe writing. I've always liked to write. And I studied creative writing in college and still love to write, and always wrote, but I don't think I even understood what being a CEO was until like not that long before I became one. I didn't have designs on starting a company. I didn't have, a vision of myself as a CEO. It took other people saying to me, hey, I think there's this job that might work for you. Actually, the first person to ever suggest this path to me was the CHRO at the company that I was at before starting Brave, who now is our CHRO at Brave. And I remember being really surprised, like, wow, really? You think I could do that? And that conversation changed my life because I think I started to believe it was possible.
So that brings up a few things for me, but I want to know first, I guess, what are some of the things that you've learned as CEO that maybe you had no clue were going to be part of your day to day, or something that you were, needed to be an expert on? Surprise, this is on your plate now. Like, what have you learned?
Let me think about that for a second. That's a great question. Because I'm trying to think about the best way to characterize the difference between being a CEO and being a operations leader, which I did before this, and what changed. And I think one thing I can't emphasize enough is the importance in any operations leadership role of being able to derive insights from data. Like, that is something that, I took statistics in college. I didn't, have any problems with quantitative skills particularly, but the journey over the past probably 10 years in my career has been getting deeper and deeper and better at understanding how to use data to know what's happening in a business. And that manifests itself in so many ways, from financial measures to strategy discussions to leading the team and painting a picture about what's going on based in the data that you have, to clinical outcomes. It's a skill that I wish I had started developing sooner. And so I talk about this a lot with the team, because I think, it's not necessarily something that we as a society focus on a lot in school. Like, I remember learning how to prove if something was a triangle or not, but not really spending time saying, okay, let's look at this data set and see what it tells us. And I didn't really get training in that until I was in the professional world, and then more in a master's program in psychology. You're doing a lot of work looking at evidence and data sets, but I still think this is a journey I'm going to be on for the rest of my life, and hopefully honing forever, and hopefully making my dad, who is a statistics teacher, proud.
Oh, I'm sure he must be so proud of you. Are you kidding me? You're reminding me of a class that I took in high school, and it was like we had a visiting professor that came from England, and so it was like new on the curriculum. And it wasn't traditional math. It was problem solving. It was a whole year of problem solving, that they would give you all kinds of different word problems or whatnot, and you just had to be able to, okay, this isn't your typical equation, and now just solve for X.
Was this the inquiry-based model?
I believe so. I mean, this is years and years ago, but it was.
If it was, my dad will be very excited to hear us talking about this on this podcast.
It was so great. Like, I can't tell you how much I gained from that class, probably more than I would have had I taken trigonometry, for example,
Right. Yes. You might not have learned as much about tangents and cosines, but you're definitely learning things that are applicable in your life.
Yeah. And every day. And it was just like, okay, there's missing, not just the conversation of what can you glean from whatever data you're given, but what can you also glean from missing data? And what
would you need to know to make a decision?
Exactly. Yes. I love that stuff.
Yeah. And that ties into, I think, another learning about this role, and my roles in operations leadership before this is, I think it's surprising and something to get used to how many decisions you have to make, and getting into the pace of making decisions constantly, not always with all the information, and being able, just like you said, to try to identify the information you would need to have confidence, and knowing that, we're living in a world where we're doing something that hasn't been done before. Well, you're not going to have all the information. That's a journey. And it's a journey that I think can be tiring. It can be tiring to start to think about how it is your job to make decisions all the time. And I am so grateful to the best team, because you couldn't do it without, I mean, our clinical leaders are unbelievable. Our operations leaders are unbelievable. Our talent and HR leaders are unbelievable. And the work that they do allows me to do the work that I do. But having bootstrapped the company and starting it by myself, I was by myself working on it day to day when I started. I appreciate that so much more, because I realized that there's the work. And of course, the work becomes more than one person can do, but there's also this parallel sort of body of work that's around decision making that is also more than one person can do. And the biggest gift that your team can give you, which my team absolutely gives me, is the trust that they're making great decisions, because that lets you free up your mental energy to make the decisions and ask the questions about the things that you truly are the best person to decide.
Well, so how do you deal with overwhelm? Because if there's a major decision-making fatigue, that's real. And one is obviously leaning on your team, but did you handpick them? How did you build that trust with them and from the get-go?
We have had a really interesting leadership team development journey, which has been fantastic, where almost all of the people on our leadership team started in a part-time or consulting way, including me. I was bootstrapping and running a consulting business when I first started Brave. And so I think that's one of the ways you build trust with people, is just more time knowing them, getting to know them, which has been so cool, and is not something that you often have the luxury for. So I feel like that's been fantastic. And, it's an ongoing, I don't think the journey of how you build trust with your team is ever over, right? I have people that I get to work with now who I've worked with for 10 years, and that is incredible. And other people who I've worked with for a short amount of time. And the amazing thing, though, about doing work that you feel is important, which I think we all at Brave do, is it does bond you quickly, because you have a shared mission.
Yeah, I love that. So when you're thinking about, I love asking this question of what advice would you give to your 23-year-old self? Somebody who's just starting their professional journey, or you, what would you tell yourself?
Yeah. I think I do, and there was a period of time where I was a career coach, and I told people this, and so I do tell people this, and I wish I had told it to myself. You have so little time. We have so little time, right? We have so little time just on earth, right? Think about the work that you really, or the area that you feel is important, the things that you really feel would make you proud to work on them, and whatever you want to bring to that field, that can be an evolution, right? Because you have to learn and grow in whatever field you're in. But I think I spent a lot of time sort of letting things happen to me, reacting to what was put in front of me, and choosing from a limited universe of options as if they were the only ones. Well, I could do this, or this. And my favorite of those three is this.
Yeah.
There were times when I didn't do that, but the times when I did that, the times when I reacted to an artificially limited universe of options, I always at some point felt how did I get here? What led me here? And the times when I said, I think X thing is important, or X thing is appealing, even in a small way, right? I think I want to work with a team of people in a smaller organization or a newer organization. That would be really cool. Then it's intentional. You've made the choice. And it doesn't always mean that you're going to love every minute of the job. And it doesn't always mean that things will unfold in the short term the way that you wanted them to, but you'll be able to look back and say, I understand how A got me to B, got me to C.
Totally.
And I've definitely had some things where I didn't make the choice that in retrospect would have been the quote unquote right choice, but I can look back and say, I made it with conviction.
Yeah. You know why you did that. I've been having some great conversations lately around like how to identify your own limiting beliefs. How do you figure
Mm.
out like what is within the realm of possibility? And it's just been a little bit mind blowing to think about how, you know, we don't necessarily need to trust everything that we think. Like there's so many possibilities that are probably bigger and better than you ever would have imagined. You just haven't imagined it yet, you know?
Yeah, I wear a necklace that says BTE every
Uh-huh.
day, and it stands for better than expected, because most of our, cognitive distortions are going to lead us towards thinking about the worst possible
Right,
scenario
exactly.
or the thing that could go wrong. Our minds don't typically show us, well, what if this was better than I thought it would be?
Hmm.
Like, what if something equally outsized and amazing happens to the outsized and negative thing that I'm imagining?
Right?
That's my little reminder.
No, I think it's a great one. I've been trying to help, to remind myself to do the same because it's like it's easy to imagine all of the ways something could go wrong or like whatever dead disaster is looming, but like it's not as easy to imagine like how things could go way better than I ever either anticipated or expected or planned for, and I got to be open for that path
And if
and
we really think
opportunity too.
about, if we think about it, I have so many examples, even just in the lifetime of this company, where things took turns that were way better than I possibly could have imagined. People showed up, you happened to sit next to this person at a lunch who said, oh, by the way, I have this opportunity. Like, I happened to get connected to a person who had gone to the same school as me through a former professor who ended up being employee one at Brave. And I never in a million years would have thought that that is how things would have shaken out. Like, there are a million ways anything could turn out. And I'm certainly able to think of a bunch of, of examples of when it wasn't what I thought it would have happened and it was better.
Yeah, and you can't necessarily plan for it either. Like,
Absolutely.
yeah, it's
Yeah.
a surprise. Well, Anna, I think we're probably running out of time, but I love talking with you. I feel like I've learned a lot, and
Likewise.
I wonder, like, if people want to work with you or follow you or get involved with Brave Health, what would be the best way for them to do that?
Yeah. Well, check us out on LinkedIn. We have a page there, and our website is bebravehealth.com, bebravehealth.com. And we're looking forward to connecting with you.
Awesome. Well, thank you again for this time. This has been a real pleasure.
Thank you, Joy. This was so much fun. Nice to meet you.